Liposuction is an art, and to me, it's all about sculpting. When most people hear the word liposuction, immediately what comes to mind is a tube that is suctioning out fat. And many people feel that that's all that it takes, that all liposuction turns out to be great. However, liposuction is much more like sculpting because you have to remove things in a manner that if you don't do it smoothly, it's going to be lumpy and bumpy. If you do it smoothly, it's going to retain the shape that you create. So it is an art. The problem is that a vast majority of cosmetic surgeons out there view liposuction as a debulking procedure. It's quite common to hear them talk about how they're going to make an area smaller. Smaller is not necessarily beautiful, and I think that's the difference between an artist mentality and a typical surgeon mentality. You hear the surgeon mentality talk about, oh, we're going to remove 1,000 or 2,000 cc's of fat, or you're going to be an inch smaller, or we're going to make you 1 or 2 pounds lighter. Those are all things about an amount. It's not about a shape, it's not about an art, it's not about creating something that's beautiful. I come from a background of art. I'm a pretty unusual case in that I have a fine arts degree. I'm one of the very, very few cosmetic or plastic surgeons out there that actually has that type of background. And what that translates to is that when I do liposuction, it's not about a procedure. It's about art. It's about sculpting. When I look at a body, a figure of my patient, it's just like I'm looking at a piece of wood in the raw, or clay, or rock. And as a sculptor would look at an object and say, okay, they would visualize what they're going to create and what kind of shape they're going to make out of this raw material. The surgeon, on the other hand, is going to say, well, we're just going to go in there and get some fat, see how much we can get out. So when I start out, I have my patient stand in front of a mirror. I feel out their fat, I know where the muscle wall is, and then I can actually show my patients exactly what shape they're going to be. I'll take their photographs, I'll draw on their photographs exactly the outline and figure that we're going to create. So we're starting from a point of knowing what we're going to create, not just ending up with something after you remove fat. And that's the big difference. That's the difference between art and just plain surgery.